We've talked about symptoms, now let's delve into diagnosis. Dr. P, how exactly is AFib diagnosed?
Atrial fibrillation is diagnosed by a recording of the heart rhythm, either on a routine electrocardiogram or by a variety of other means. There are a whole host of devices that can allow one to make the diagnosis of atrial fibrillation. Some of them have the capability of identifying an irregular rhythm and let the person know they may have AFib. Others have the ability to record the actual rhythm, and that's much more valuable to the clinician because they can then determine whether it's truly AFib. The physician can also order a variety of wearable devices that can detect AFib. A common one is called a Holter monitor. This is one where one or more electrode patches are put on the chest wall, and these can be used for a duration typically 1 to 7 days. The more modern ones are much easier for patients to use, and as the figure shows, they consist of a large Band-Aid-like device, and this device contains the recording system in it. Some devices have the capability to detect automatically the presence of AFib, and they then send that recording to a monitoring center and eventually to the physician who ordered the test. These are actually very valuable because they allow what is called silent AFib, in other words, the patient doesn't know they're in it, to be detected, and many patients have episodes that are actually ones they don't feel. Other types of devices need to be what's called patient activated. The patient's given some sort of device to carry with them, and they can use this when they feel symptoms. Less commonly, a device can be inserted below the skin on the chest wall, and that can detect abnormal rhythms usually up to 3 or 4 years. These are particularly valuable because they can identify something that's eluded diagnosis, often for a year or more.
And that brings us to our next important topic, risk factors. We will dive into that in Chapter 4.